From the News Channel 5 Network, this is OpenLine.
Hello, everyone. Welcome to OpenLine. Full house tonight, full group of guests tonight, and we are talking about a very important topic, Insure Tennessee. We have covered the fact that it has not passed, but there is a strategy to bring it back up again. We're talking about expanding Medicare. So how will that be done? That's what we want to talk about tonight. We have three people up here who can certainly explain that to us, the pros, and certainly they support that. We can talk about whether it's appropriate as far as you're concerned or not. You can call, but let's introduce our guest. Tony Garr with Enroll America. Tony, thank you for being with us.
You're welcome.
Senator Richard Briggs, Dr. Briggs, Republican from Knoxville. Thank you for being with us.
Glad to be here.
And Bruce Parks from Clarefield in Campbell County. Mr. Parks, thank you for coming all this way to share your story. Thank you very much. So when we talk about Insure Tennessee, when we talk about expanding Medicaid, let me start with you, Senator. Why do you feel this is so important?
Well, if you look at the statistics, our state does not look good as far as being a healthy state. We're the 45th most unhealthy state in the country. Another that does affect economic development is that there's only 7 states where people miss more work due to physical illness. And I think if employers are looking to come here and open factories and have people to work here, that's a significant impediment for them when they know that the workforce is not very healthy and a lot of people are missing work due to physical illness.
So it's the health of our citizens. Now, we've had the Affordable Care Act people come on and talk about how people sign up for the Affordable Care Act, also known as Obamacare. And there's a large group of people, when we do that show, who are not eligible. They're part of the coverage gap. And we're talking 280,000 people. Tony, explain that to us.
Oh, good luck. It's actually when you talk with people about that, when they call you up and say, you know, I want to enroll in the Affordable Care Act, and you ask them their income and their family size and say, oh, you're in the coverage gap. And trying to explain that to a person, what do you mean? I don't have any money, or I work part-time, or my job, I'm working, but, you know, how can I be in a gap? I thought the Affordable Care Act was supposed to cover everybody. And so that's what's so confusing. And that was created by the Supreme Court in 2012, when the Supreme Court basically told the administration that the federal government could not require states to expand their Medicaid programs, even though it would be mostly paid for by the federal government. The Supreme Court said you can't do that. And so that created the Medicaid expansion, an optional program rather than a mandated program. It's optional. So then states had to choose it. Well, Tennessee is one of those states that have chosen not to expand their Medicaid program or to fill in the coverage gap.
And we can talk about why, and there are arguments about why that did not happen. Insure Tennessee would have then closed that. It would have been our own unique negotiated sort of way of expanding Medicaid and going into the Affordable Care Act. But when we talk about people in the coverage gap, and we have a graphic, 280,000 people, who are we looking at here?
Well, when you go to a fast food restaurant, you eat at McDonald's, you go to Wendy's, when you go there, you basically, someone serving you is likely in the coverage gap. When you shop at Target, when you shop at Walmart, those stores, and the person that's checking you out, many of those people were in the coverage gap. So these are the people that are working. You go to a nursing home, the people that are basically changing the sheets, cleaning the nursing home, cleaning the hospitals. A lot of these folks are in the coverage gap. So they're actually working. They might be working part-time, and they might be working part-time, 2 different jobs part-time, because they can't get a full-time job.
So for a single person, if they make less than what? Or more than what?
If they make less than $12,000, a single person, they fall in the coverage gap.
So they work perhaps, but they make less than $12,000 a year.
Yeah.
So they're not going to be able to go and get health insurance through the Affordable Care Act.
Right. Exactly. It's not sensible. It doesn't make any sense. And you almost have to map it out and sort of do the math and just show them if you made $12,000, you would actually get help with paying your premiums, paying the deductibles. We could get you a plan that costs $20 or $30 a month, and maybe an annual $500 deductible. Blue Cross Blue Shield plan, Network E, good plan. But if you make $11,800 or something like that, you get no help. You get no help, and all of a sudden you're paying the full load. And most people who are that income, they can't afford it.
So this was brought up before the legislature failed. One of the, obviously it gets embroiled in the politics of the Affordable Care Act, Obamacare. The argument against it has been that we can't afford it. That once we start expanding Medicaid, the federal government helps for a while, but then after a few years they don't. We can't afford it. It's not the right thing to do. Senator, what do you say to that?
Well, I want to add one thing to what Tony said. There's another large group too, and it's the veterans. We have 28,000 veterans in the state of Tennessee that do not have insurance coverage, and they do not qualify for any of these plans. Many people think that if you served in the armed forces, well, you can go to the VA hospital. That's not true. You can go to the VA hospital if you're in a certain level of poverty, and you can go to a VA hospital if you have a service-connected disability. We have 28,000 Tennesseans that are good, hard-working people that served their country. They weren't injured in war, they don't have a service-connected disability, and they don't have insurance. We had an opportunity to take care of them, and we're not doing it.
So can we afford it? When you hear that argument, and I think that's maybe the biggest argument, that we can't afford it, what do you say? How do you respond to that?
Well, first of all, I don't understand how you can't afford to pay nothing, because this plan, Insure Tennessee, does not cost the taxpayers a penny. And people say, well, how can that be? Because look at what's happened to some of the other states. They did have to pay. Well, what is very unique about Insure Tennessee that makes it a very attractive program, I mean, it's really a deal you can't turn down, is that by the year 2020, the federal government will pay 90% of the cost of expanding Medicaid. The 10% under the Standard Affordable Care Act, under Obamacare, was paid by the states. The Tennessee Hospital Association came to the legislature and came to the governor, and they said, put a tax on us. We have so much uncompensated care, so many people that can't afford to pay anything. If we put a little money in, we can get that federal matching dollars. And let me tell you how much that is. You put $1 in, you get 10 back. And that's why the Tennessee Hospital Association and the hospitals are willing to do this. And so what the legislature did, we can put a 6% assessment fee that they're asking for, and that'll raise enough money and more to cover the whole program, so it costs the Tennessee taxpayers nothing.
So that argument that we can't afford it, it holds, in your opinion, no water?
It holds no water. Now, there were legislators that said, well, I don't trust the federal government. You know, they'll back out on the deal, or the Tennessee Hospital Association will back out on the deal. You know, people were saying that when they brought Medicare on in the 1960s, and when Social Security came around in the 1930s and 40s. I mean, maybe one day they won't do it. But so far, the checks usually come. We take 53% of the funds that we receive, the TDOT receives to take care of our roads, are federal matching funds. We're not turning down those dollars. And the dollars, people say, well, we're borrowing it from China, we're borrowing it from our children, we're going into debt. If you look at your pay stub, there's a little section there that says Medicare. And what's happened is that the hospitals and the doctors have voluntarily taken very big cuts, billions and billions of dollars of cuts. The Medicare Advantage program took a cut. That money was put aside in addition to some other revenues. That money was put aside for that 90% that the federal government will pay. So this is money that has come out of Tennesseans' pockets. It's gone to Washington. Washington says, here it is for the taking. It'll be $1.3 to $1.5 billion per year. And if we do that, then if we can take that money back, it's not only the right thing to do to take care of all of our uninsured Tennesseans and our uninsured veterans, but it's also the right thing to do from an economic standpoint.
It's quite remarkable the hospitals would tax themselves and they would cover that. But that shows the situation many of these rural hospitals are in, right? So what if we don't? And we've heard some warnings about what might happen if we don't. But what if we don't? What does it mean? Obviously, there are lots of people who aren't covered, but what does it mean for hospitals?
Well, it's going to be the hospitals, and Randy Boyd, who is our Commissioner for Economic Development, has stated this very well. I'll tell you, I'm from Knoxville, Tennessee. In our town, Baptist Hospital, which was right in the downtown area, is now a pile of rubble. It's been knocked down and there's just a bunch of sand and bricks there. That hospital closed to a large degree because of uncompensated care. I work in a hospital that's in North Knoxville. It's not an affluent neighborhood. It's going to close within the next 18 months as they built a new hospital out in the wealthy area of town. That's 2 hospitals right in Knoxville. You look up at Scott County, not far from, our friend from Campbell County. The Scott County Hospital at one point closed. Now it's opening and closing and having trouble. In Campbell County, the Jellicoe,
yes.
The Jellicoe Hospital is in serious financial difficulty. They may be able to pull it out, no one knows. This is all due to uncompensated care. Many times in these rural communities, the best employer that has the best and the highest paying jobs are the hospitals. Randy Boyd, our Economic Development Commissioner, has said when these hospitals in rural areas close, we'll never be able to recruit business and industry to come there.
All right, we're going to take a break, and we're going to open up the phone lines. If you want to call, there's the number, 615-737-PLUS, 615-737-7587. If you're on the line, hold on. We're also, when we come back, we're going to hear from Bruce Parks, who came here to tell his story. We'll take a break, be back right after this.